All right, so we have Julie, Christy Hutchins from HCL, Julie Cahoon, Jonathan Collins,
Larissa McLennan.
Yeah. And then Joseph Ray. Hey, Joseph, did you get a chance to talk to your friend in Santa Fe about the webinar?
Yes, that was 2 days ago. I emailed him.
Okay. I think we're going to have our planning meeting next Friday, so, if we're good on this, I want to make sure he's on that call.
Right. I'll try and coordinate that with him. I know he's pretty busy.
Okay.
Okay.
All right. Okay. Today is what, the 20th? I was hoping Melissa was going to be on the call. Yeah. Let me see if I can email her real quick. Last week we had a really good experience. And Ron Ross had contacted me because he thought our steering call was this week Monday. And so I just reminded him that it's always the second Monday of the month. And so also, I don't know if you all heard that Carly Clausen that works with Tammy at Morningstar Care Center had a heart attack in March. And I did send out a card for her, a sympathy card or a get well card. So I'm not sure if Melissa's going to be on the call. I was kind of hoping she would be. We did not have a speaker for today, so it's 12:10. So I'm just going to go ahead and we'll probably have a fairly short call, Joseph. But just kind of to keep everyone abreast of what's going on. On my agenda here. That I know of, we don't have any new members. We took a few people off. I guess Gerald Hodges is no longer up in Bethel. And we took off Sheila Wiggins because she had gone to work for Genesis, and she asked if we could just take her off. We added Rick Richards, who's our new COO, and also Rosie Abad, ABAD, who is our new administrator here, and she had worked, I guess, in Colorado before she came here. Was there anyone else, Julie? I'm trying to think. Did I send you any other contacts?
No, I think those are the changes that we covered.
Okay, so we're just communicating well so that our records stay up to date. And this call is being recorded correctly, correct?
Yes.
Okay, so our old business is some things that we need to talk about a little bit today. We did have our steering committee meeting on April 9th. And then we need to talk about our annual meeting a little bit. Our March meeting was actually March 12th, and Thursday, March 15th was our last actual meeting. If I can get to those minutes. Yeah. Sorry, I thought I had them pulled up here. I have the February one pulled up, but not the March one. Most of our March meeting was Dr. Jordan Lewis speaking on cultural awareness, and that is our upcoming webinar on May 23rd. So we have a pretty good sense of who's going to be speaking on that call, and we're going to try to have a meeting next Friday to kind of put that together. So I'll moderate, and then we've got Dr. Jordan Lewis. Julie, you didn't get a hold of Don Thibodeau, did you?
No, I don't have his email address.
Yeah, the banner one is not good, and that's the only one I had. I did not hear back from Agnes, Sweet sir, but we need to see if she'll do that. We did get an okay on Dr. Ferguson from Val's referral, and he was willing to, he's got a picture and a bio already, which is great. And then Joseph, yourself, and possibly your colleague also. So that would give us, without Dawn, that would give us 1, 2, 3, 4, 5 plus myself. With Dawn, it would be 6. So, and without Dawn or Agnes, it would be possibly, I mean, I'd like to see more than 3. Joseph, what do you think? At least 4, wouldn't you think, on the panel? Do you think 3 would be enough?
At least 5, again, adds to the discussion I think we concluded. So that's why I want to include my colleague, Mr. Pecos. He helped start up the New Mexico Indian area back in the day. So I think he would be a good person if he's able to schedule it with us.
And so, yeah, I think you're right. I think having 5, that would be ideal. So we're going to need to try to get a hold of Dawn Thibodeau and also Agnes. We're going to have to try to reach out to them. So at least one of them, probably, plus your colleague needs to be on this. We talked about a title that would be kind of catchy, getting people to watch, maybe like creating some kind of a tip sheet or, you know, something they could take home with them. And even do some polling. Julie, we'll have to talk about that where we can get some ideas from the audience. People have ideas that we can incorporate. So, did anyone have time to look at the best practice report that came out on CMS.gov on cultural humility? Did anyone have a chance to look at that?
No.
That is posted there now. And Julie, you sent it out also in the, did everyone get their email last week? Our monthly email should have come out, our newsletter that had the announcement for today. I'm wondering, Julie, if we need to send out like a day before. I know we didn't want to bombard people, but I'm afraid people are just forgetting, even though it's always the same. You know how that goes. People get busy. And I'm wondering if we need to do a day before reminder. What do you think?
Yeah, I can do that.
I think we need to, because with the attendance today, it makes me think that people just are busy, you know, and just forget.
Mm-hmm.
And a week ahead, you know, a lot happens in a week, and you forget. I know how that goes. So I'm having to type while I go here, so forgive me if there's a little bit of a gap. So check out that best practice report on CMS.gov. It is posted. Yeah, so I'd say the day before, just to get everyone on the call. Okay. Okay, so that's good. We have a few other things. Oh, here's my minutes. I'm holding them and didn't even realize I had them in my hand. Oh, jeez. Because I had some other things scribbled on it. Hold on. So let's see. We had 1, 2, 3, 4, 5, 6, 7, 8, 10 people at our last meeting. And so we greeted Shannon Santosi, which she's from the Carl T. Curtis. So that was great. And I think Lisa was on our call with the QAO, so that was good. And I think Shannon said she was finishing her administrator's test in May, so I'm sure she's very busy right now. And I thought we had a great talk on cultural humility. A lot of good ideas came out of that. We also, Teresa Holt was on the call, so that was good. And we got the manual that Dr. Lewis authored but has not been published yet. He just doesn't want us to share it quite yet until he can get it officially published. But he did send copies out to some of us, so we can use that, Julie, in our planning, I think, for the webinar.
Okay, great.
Yep. And then, Joseph, you can give a little update here in a minute on anything you've done with, NCAI or anything like that. We do need to talk about our annual meeting. I haven't heard anything else on the WEP funding. I got a call with Lisa O'Neill, and they're hoping with the budget passing or whatever that they'll get some money at least for another year because the current GWEP ends June 30th, just so you know. I have not talked to Randella Bluehouse from NICOA. Has anyone spoken to her recently at all?
Nope.
You know, I'm wondering, Joseph, if it might be good to reach out to her and see if we can get her on one of our next calls just to give us a little update on what's happening in her world. What do you think?
I'll reach out to their office, but I think Randella's probably pretty busy because of the upcoming annual conference that they're having in California.
Oh, okay.
I think it's in September.
So you're right. What's that, in August?
September, I believe.
Okay.
But I'll reach out. Usually, Miss Rebecca Morgan corresponds with me, and yeah.
Okay. Yeah, that would be great. I mean, just even if she was just on for a few minutes to kind of say hi and keep in touch, you know what I mean? Just like a little something, kind of give her an update on what we're doing, that type of thing. Did we ever get a contact with National Indian Health Board? Do we have anyone that we can connect or reach out to with that group? Joseph, do you know anyone that is with the National Indian Health Board that we might be able to connect with?
Was that for Julie or Joseph?
No, for Joseph. I just wondered if you had anyone with the National Indian Health Board that we could possibly connect our group with.
I usually connect with them at the National Congress of American Indians.
Okay.
Their leadership, Stacy, I believe, leads one of the subcommittees there, but they would be a very good resource to join up with. I know they, as far as I'm aware, there is not a lot of policy or a lot of language around our cause as far as elder issues, nursing home care. Right off the top of my head, I can't think of it. But I was just about to pose the same question to Julie from Kaufman if she had contact with somebody from NIHB.
Julie, do you guys in CMS, do you have any contacts with NIHB?
Actually, I think Jonathan might be able to answer this a little bit better because I know he does a lot of work with G-Tag. So I know that we are aware of people that work at NIHB, and there are folks that we can contact there if we need. Jonathan, is that accurate?
Yes, that's true. I can look at the list of names that I have through G-Tag and see who we can contact.
I mean, I would like them to reach out and just kind of tell them about who we are and how we're kind of meshing with the long-term care subcommittee and, you know, kind of where we kind of stand and just kind of make them a little more aware of us as an entity, you know.
Mm-hmm. That's real surprising that they haven't contacted us because I was hoping that the exposure that we had in Spokane 2 years ago would have connected with us. You know, that was probably my fault because I was running all over the place, and you know, I didn't snap that I should have introduced you, Debbie, to those persons there at Spokane representing NIHB. But again, we definitely need to be part of their world, I believe. But I think that's a trend in America and everywhere about the denial of nursing homes and the care that we give. People want to say that people want to ignore it, and we see it. So anyway.
I think it's scary for some people, and you know, I think one thing, just so you all know, like when Cynthia LeCount was on the call. We talked about this a little bit on the steering call, too. You know, that U.N.I.T.E and tribal nursing home being part of, you know, home and we're part of that whole continuum of long-term support service. I mean, we're all essentially taking care of the same elders, so whether they come from the home to us, a lot of our residents anymore are short. They're short-term. You know, they're here and then they're gone again, and some of them, you know, they go out and visit family and come back while they're here. So there's a lot of flow back and forth, and rather than kind of set us on a shelf over on the side, right, Joseph, where we're easy to ignore, you know, we are under a lot of, you know, regulatory mandates right now, and I'm an optimist, I admit it, but I do think that the QAPI and some of that is really going to make a difference in long-term care facilities and making them a little more responsive to the residents. And I think over time that actually is going to improve. I think if nursing homes really take that mandate seriously, that these could be places that aren't always so scary. And we actually get a lot of compliments from our elders. Not that we never get any complaints, but we actually get a lot of compliments. And I think
here's some news I'll share with the group. In our great wisdom, the Laguna Rainbow Corporation, which manages the nursing home, and our senior center, which is the community-based care system, the board has created a chief operating officer position to be a go-between between tribal council and our management organization and the board. We need this COO to be knowledgeable of tribal infrastructure and tribal management ways, which is a whole another textbook. And so we're hoping that this really helps us in our management of our own nursing home. And in fact, we would like to do away with our management company and take it over someday on our own as the Laguna Rainbow Corporation. So, again, we're trying to make inroads with our tribal leaders to be that we're on their radar, and not as a bad place, but as a good place.
Right.
Yeah. And so, again, we have so much turnover with our tribal leaders that we bring so many different opinions at times, and reflection, and at times it's a negative reflection of the community, because at times, you know, community only wants to hear the bad things that go on in nursing homes, and that's unfortunate. And here in my community, to share with you, and it's a negative, unfortunately. The community-based senior group really wanted to break away from having any place with the nursing home. They felt that the residents of the nursing home were in such a state that it depressed those elders that were still active. And to me, that's really unfortunate, because that's just another way of segregating our elders from each other, that they don't have an empathy for each other. Their statements from the community elders that they were really bothered or uncomfortable with the sounds that our nursing home elders make at times. Their cries at times. They're crying out. Their tendency at times to be sleeping, and so that's unfortunate. And that's my goal, is to break those barriers down. I love all my elders, and there shouldn't be that divisiveness. So again, that's what we're battling, and that's what we're hoping our new our chief operating officer will bring to our our program. Her name is Kathy Correa. She accepted the job, so I'm not divulging any secrets. Kathy Correa has a background here at Laguna Rainbow Center, our elder center, our nursing home, and she brings a nursing home administrator's license also with her. So she's a Pueblo member, a tribal member.
Okay, great. How do you spell her last name?
Correa, and her first name is with a K, or she goes by Kathy, Kathy.
Okay, great. Thank you so much. So, do you still have the your current administrator there, or should she leave?
She's going to remain in place. But our current management agreement with On Point Incorporated runs out September. So we're in the process of negotiating a new deal, a new contract, or either maybe eliminating that contract.
Okay. All right. Hold on a minute. I just want to send this to Shelley Dilstra, because she just sent me saying she can't find the correct invite. So let me send her this and see if she can join us. Okay. Thank you, Joseph. That's really helpful. Okay. And I agree with you with that segregation, and it kind of leads to that lack of really empathy there. I think that's really good. We had a speaker here for some of our staff from Nadito in Tucson, which is a group that works with children who have lost someone in their life, either by death or abandonment. And they did a little webinar, like a telehealth webinar on Tuesday. It was quite good. And they showed on YouTube, there's a woman who deals with this topic a lot. Last name is Bene, Bene. But there's a YouTube short 2-minute video on the difference between empathy and sympathy. And it's animated, and it's actually pretty funny. It's really hysterical. But, just this idea that kind of looking at someone and saying, oh, wow, that's really bad, but you don't really have any real, empathy for them, and how can we develop that? It was very good. It was really good. So, and I'm sure we're all aware, and this is something, Joseph, we might want to take up with the group after the summer, is looking at maybe for next year for our topic is dealing with maybe trauma-informed care, because that's something in 2019 that CMS is expecting us to do some training on and work on a little better. And so I've been doing some research on that myself, but we may be able to do some work with that in the coming 2019 on trauma-informed care, and there's lots of pieces of that. So, all right. And do we have anyone, Ombudsman or QAO, on the call? Okay. I will say thank you, Julie, for doing that updated directory. We do have some QAO folks listed there that we have not really reached out to, and I think we need to look at that. I want to wait till we have more people on the call to discuss that. And so KAI will give us an update now.
Okay, so as we kind of talked about earlier, we have completed the cultural sensitivity report that went out in the April U.N.I.T.E newsletter. So now we are collecting information for the May U.N.I.T.E newsletter. And so the due date for content submission for the May U.N.I.T.E newsletter will be May 2nd.
And that's always the first day, correct?
Correct. It's always the first Wednesday of the month.
Okay.
And again, content that we're looking for is anything that might be of interest to tribal nursing homes, any information about upcoming events or conferences or trainings. Also, something that would be really nice is if a nursing home shared a story about any changes at their facility, about their residents, or any community event that they, took residents to, anything like that. I think that would be a really nice touch to share that type of information. Otherwise, again, trainings or other information you think is pertinent for the group.
Okay, very good. And I mean, you could even get, like, here we're starting up our gardening program again. So you could get your person heading that to just write up a little paragraph or something and just share it for the U.N.I.T.E newsletter, which would be nice.
Yeah, that would be perfect. And, photos are always a nice touch as well. So if there's a photo to accompany a story, that would be great too.
Okay, very good.
And then we are looking to begin work on the third best practice report, and that will be on financial sustainability. And so we have briefly outlined who we would like to participate in the July webinar, and so I would imagine those same folks would be open to working with us on that report. But KI is still developing the structure and format for that particular report, and once we have that finalized, then we'll be reaching out to folks to interview for content for that report.
Right, and we'll do that. We'll do that phone interviews again, right?
Yes. Mhm.
Okay. And I think we have so far, Joseph, just Ron Ross and Val and Tammy Reed, and I think we said Leo Litsky, and there was someone else. Well, I guess Rick, possibly Rick Richards here that started here. So I think we've probably got about 5 people right now, but I'm hoping we'll do this.
And so that
we need to get someone from one of our facilities more on the East Coast to talk to, because we always tend to be more west of the Mississippi. I'd like to kind of reach out that direction a little bit.
Okay. I'll check our contact list and try to get someone over on the East Coast.
Yeah.
Okay. And then, as we've already covered, we have the CMS LTSS webinar coming up, and U.N.I.T.E hosts the May webinar, so that will take place on the 23rd. And we have a planning call set up to kind of begin discussing that webinar structure on the 27th. And so I just sent out an invite to all of the panelists that we are aware of at this point. So that includes Joseph Ray, Jordan Lewis, Dr. Ferguson, and so I would just need to forward that on to anyone else that needs to be involved.
We need to see about Agnes Sweetser, and then who was the other one I said? Don Stevens, if we can find his contact. Joseph, you don't have any contact for him, do you?
I'll have to look it up, but I can check.
The one at Banner doesn't work anymore. That's the old one I have.
And then the only, upcoming item that we haven't started planning for yet, and there's still time, is then the July CMS LTSS webinar.
Right, exactly. Okay. All right, so this next best practice report will be the second one for this year, correct?
Yes.
Okay, so when we do the third one, I'm thinking we can pull some stuff that maybe come up on our webinar May 23rd to put together maybe a best practice report, like a follow-up, maybe. I don't know, Julie. I'm just thinking ahead for that one.
Okay.
There may be something that comes up with a speaker or something on the webinar that we can pull off of and create the next best practice report. Because unless you have something else you want to do, we do another one on cultural humility, right?
Yeah, we could.
If Dr. Lewis, if he gets that published and gives us permission to distribute, we may be able to use that as that third best practice report. I don't know what you think about that, but we may be able to use that without doing a bunch of interviews. We may just be able to use that and send it out. I don't know. That's what you think about that.
Okay. Yeah.
If he's willing, if it's tidied up and it's published and he's willing to let us use it. So, okay, thank you, Larissa. I appreciate that. Any administrators on the call? Any directors of nursing or board members? All right. Anybody had a recent survey? We're close to August. We could get ours any day. Joseph, you guys get state surveyors, right?
Yes, and I think we're probably in the window. That hasn't been announced, but I have this feeling we're almost in that survey window by the state. Seems about the right time of year.
Okay. Well, we could have ours any day. I mean, literally, they could come out here on Monday. It's that close. So we've been doing a lot of things to get updated. I do not have any grant updates. We haven't done. We met at our annual meeting. We talked about grants. We had that meeting that afternoon. I've talked to Rebecca since then a couple times. She hasn't always been able to be on this call. We haven't totally forgot about that. I mean, I think, honestly, infusing some funds into this collaborative wouldn't be a bad thing. I mean, we've been supported partly by Archie and partly by the GWEP up till now, but I think we're going to have to long-term have a second plan. We did talk about getting kind of a grant subcommittee, but I don't want to address that right now because we just don't have enough people on call. But I think that's something we should look at. Did anyone else join the call? Okay. I did want to I was on the TTAG call, so the TTAG call is always the second Tuesday. So it was actually April 10th. I think they did not have one in March, but they did have one in April. And I was on that call. Dr. Parker was on that call. And so she talked about the long-term support service tribal survey that's supposed to start next month. They vetted it and looked at all the different questions. Some of you might have contributed to that. So there'll be a lot of participants with that. And then the strategic planning, it's like a business plan. So that's, again, Joseph, that's the National Indian Health Board. They have a current TTAG plan that represents 2013 to 2018. And so they need to redo that, and they have to complete it. My understanding is by August 30th. So, Julie, I'm going to send you that TTAG plan that John Johnson sent, and then maybe you could send that out to everyone, and they could be thinking about that because it's time to update that, and we would like to get our piece of it, any kind of thoughts we have onto that. So I forgot the guy's name who was on the call, but he was saying that you want to look, when you look at that plan, you look at the goals and objectives and kind of look at what was implemented and what was not, and then see if there's like items that weren't implemented or were underfunded and are they still a priority, and kind of advocate for those, or are there new priorities, new initiatives, that kind of thing. And so this will be kind of like a roadmap for the next 5 years. I think we want to get on the roadmap. And this is something that when we have our annual meeting in Washington, D.C., I'm setting up like a half-day visit to Capitol Hill with probably 3 different groups for not just us, but for the Title VI folks too. And this is something we could take with us, the results of the survey and the strategic roadmap for the next 5 years for long-term support service. Hopefully we'll have it by then. And that's something we could take with us to advocate for at Capitol Hill. So anyone have any thoughts on that?
Just again, that any congressional support that we can get for the day we have the grant committee functioning will really help us, because it's going to take a major effort legislatively to get a set aside for nursing homes that are tribally oriented and based. So, the congressman, as probably your experience, Debbie, is congressmen will direct us to their staff that can write letters of support for grants for us, and that'll be helpful, as you said, for us to have an infusion of grant money from somewhere out there, maybe through ACL or through other foundations.
Okay. You know what? I'm glad you said that because when I was in that leadership academy and went and talked to some staffers, you're right. That's one thing they said they could do is write letters of support, and that'd be really good, Joseph, because that might help us get a grant. And like Rebecca said, some of these aren't just planning grants. They're money that could actually be used to do a program for elders or something to help to actually make their lives better. And we could look at that. So that's really good. That from our perspective, that would be worth visits to Capitol Hill, to talk about what we do and who we are and ask for letters of support if nothing else. I mean, I know Cynthia wants money, and I get that. But, okay, so good. Dapper. Okay, that's really great. That's great. And I know Rebecca will help us if we get our subcommittee together from this group. So that's really good. So then I'm just kind of, anyone here from a tribal assisted living or any kind of assisted living facility? Anybody on the call? Okay. CMS.gov website, please go and look at our little section there because it has been updated. I think the calls, Julie, are pretty far behind. How are we doing on getting those updated?
Yeah, I think there's been a bit of a backlog. First, there was a bit of a backlog on KAI's part, and then there seems to be a bit of a holdup at CMS. So once we get that kind of confirmed, then those recordings will be posted to the website. Okay,
and we are, I guess, I don't know if I can tell you all this or not because Melissa's not on the call, but she has announced it. My understanding is she will be changing and not be at Anchorage Native Tribal Health Consortium. So I think we're going to need someone to be kind of with, to work together on the U.N.I.T E. I think there needs to be someone, because Melissa and I were really co-leading this, and I really want someone from the collaborative to step up and co-lead it, because I may not always be here. I think we need to have that leadership. So if we can be thinking about that a little bit. And then, let's see what else. We need to talk about our annual meeting. And, of course, that's an opportunity for advocacy and working on tribal relationships, which is good. Our annual meeting is going to be part of the ATL. So, Chrissy, can you tell us just a little bit more? Do you have any updates on the agenda for the annual meeting? Just give us a little update on that.
I'm afraid that I don't. I know that it's not until the end of the month, I believe, that contract all gets signed. So I think that we'll start hearing more in May. But I do know that I believe that the current plan is that the Monday that they'll start, which is, I have to look at a calendar, I think it's August 13th.
August 13th, yeah. Mm-hmm. Yep.
Yeah, so that's usually and I believe the current plan is to have that be the pre-intensive training day that they usually do. And then Tuesday will be the consultation listening sessions, and I believe it will go until Thursday afternoon.
Oh, really? Okay. Also, will it be half day on Thursday?
I think usually it ends a little bit on the earlier side on Thursday, yeah.
So when would you, if I'm trying to set up the meeting on Capitol Hill, what would be the best day or best time to do that? Because Cynthia said something like a half day. But the sooner I reach out and do this, the better. Would that be, should I do that Wednesday? Should I do it Thursday? What, in your mind, what might make sense?
I would have to defer to Cynthia. I would reach out to Cynthia and ask her what her preference would be. She would know better than I.
Okay. Also, she mentioned she was on our call on April 9th when we had our steering call, and she did mention a couple people that she was going to put me in touch with, but I haven't heard back from her. And those were, let's see, let me find my notes here. She works with someone in North Dakota, Karen, and also Elena Steep in Wisconsin, I think. I need to see if I can reach out to both of those people.
Okay. I should
also, there's someone in your office that I could talk to. And I think it's going to be in Washington, D.C. It's at the Marquis Marriott. They're trying to. I did get that. Yeah. Oh, I know. I think it was you, Christy. She said get the planning and evaluation. Sorry, I'm reading my notes there. Planning and evaluation report. Can I get that from you?
Yes, of course. I will forward that to you right now. It's our interim year one report for the Title VI evaluation. So I'll send that to you. For UND, could it have been Colette Adamson, or was it definitely a Karen?
No, I wrote down. I'm pretty good with names. She did say Karen, And Karen was there for 17 years. I one in North Dakota.
Okay.
They're under contract. So they were under contract with Title VI.
Okay.
It had to do with like Medicaid and getting people,
Gotcha.
on Medicaid. Yeah.
Okay. I will follow up with Cynthia.
I think Tammy is planning on coming, and I think she's someone that really wants to, have some time to talk to, because she gets really involved with, helping elders understand, how they get onto Medicaid and stuff like that.
Okay.
So yeah, I can take a look at that report. So that's a report. How do those reports work? Can you kind of explain that to us? How do those? You said like a year one report. How does that work?
Sure. So this evaluation, as I'm sure you probably know, this is the first ever evaluation of the Title VI program in its 40-year existence. And so what we have done is we're using a participatory approach to evaluation, which is a little bit different. The federal government does not generally do that. And what that means is that we've been working really closely with different stakeholders to design this evaluation, basically. So we started out with a steering committee, and then once we invited all of the Title VI grantees to apply to be a part of the evaluation. And then based on a couple of criteria, so for instance, they had to be a current grantee, they had to have completed a U.N.I.T.E assessment, and those are pretty much the only two criteria. And they had to have an interest in participating in the evaluation. And so we had a number of different programs, different Title VI programs apply, and then we made our selections. We were looking for 30. We had 18 apply, and then based on the criteria, we were only able to take 13. And so then we established an evaluation working group, which we also refer to as the EWG. And so now we work with our evaluation working group to basically, so for instance, that's who we went to ask, what do you want the annual report to look like? So you'll notice when I send it to you, and I can send it out to everyone, or I can send it to Julie and have her send it to everyone. That it's a little different than you might normally see, and we quite like it. And it's more graphic, and it's shorter than you might. A lot of times the federal government likes to produce, sort of lengthy tomes that are sort of hard to get through, and this is not like that, and that's based on the feedback from our grantees. So it's a 4-year process. So it's a long-running evaluation, and there are 4 sort of basic research questions that ACL is interested in, which basically boil down to, how is the Title VI program being run? What are the sort of specific differences in different areas? So, for instance, we know that not all of our programs are doing things in exactly the same way, obviously, because they have different communities that they need to serve. And then finding out how ACL can do a better job of supporting our Title VI programs in, those kinds of differences. And then the other sort of piece of it is that we're working closely with our contractor, who for this endeavor is ICF, to help Title VI programs better use their data. And that is actually outside of the purview of ACL, so we don't see that data. So, for instance, if one of the participating programs wants to share, data that they have from some other source with ICF to sort of figure out, how can we better leverage the data that we're already collecting? What other opportunities are there for us to use this data to get funding, basically, or for whatever else the programs or the tribes may want to use that data for? And that's a part of the training and technical assistance portion of our evaluation, but that data is not shared with ACL.
Wow. What's ICF again?
It's way long ago. It stood for Inner City Fund, but now they literally just go by ICF.
That's really interesting. Thank you for sharing that. And you said across the country there's 30 grantees, is that correct? 30?
That's what we were going for, but we currently have 12. It is also our feeling that this is sort of a pilot run at this. It's an endeavor that we would like to continue within the future. So we're hoping to do like another round of evaluation after this one has concluded.
Wow. Are you under, like, by law, do you have to do this now every year? Or?
No. So I'm in the Office of Performance and Evaluation at ACL, and by law, we are supposed to do evaluations, regular evaluations of our programs. Currently just the aging programs, but this has never been done before, so we would like to continue doing it. There's a lot of work that Cynthia has really, she's done a nice job of energizing ACL, I think, around our tribal programs, and so there's a lot of support, more support than there was before coming to her.
Mm-hmm. I can only imagine knowing Cynthia. So you said 18 applied, but only 12 were accepted, or did you say 13? I want to make sure I get that right.
13 were originally accepted. Unfortunately, one of our grantees had to, or one of the evaluation participants had to drop out of the evaluation due to just a lot of turnover and other issues that didn't allow them to continue in this particular round of the evaluation.
And when you say a grantee, you mean a Title VI program? Like,
yeah,
there's
so
one for Trolley Brook.
Not necessarily. So when I say grantee, I mean it gets tricky with the sort of language. So they're the Title VI grantees. Sometimes we refer to our evaluation, our Title VI programs participating in the evaluation as grantees, but we don't actually provide them grants. ICF provides them a chunk of money to help support the evaluation. And so they are technically subcontractors to ICF in that endeavor in order to get that money. So it's not a federal grant. And there are, a number of things that go along with the evaluation. Obviously, there are a series of focus groups with elders. There are focus groups with caregivers. And there is a caregiver evaluation. And then there are program staff interviews.
Oh, wow.
And we'll be doing site visits over the next 3 years.
Oh, you actually do site visits. Okay.
Yes, they'll do a site visit every year, which is great. And we're actually getting ready to start our site visits. One of our first is in Alaska, actually.
Really great. That's awesome. We need to talk more. That's really interesting. I learned a lot. Okay, so I hope everyone enjoyed that. Anyone else join the call? Joseph, are you still on?
No, I'm on.
Okay, great. Okay, anything else you want to say, because it's almost 1 o'clock?
No, I think, again, that we just keep going forward, and, I just think we need to maintain as many contacts with the organizations that serve our communities as best we can. Again, like you were saying, we need to get Randella on the call next time. So thank you.
Yeah. Thanks. Okay. Keep lunging forward, everybody. Thank you to all of you for staying committed and staying involved. And if you talk to Cynthia, would you ask her, Christy, to see if she could reach out to me with those 2 people? And if she has any thoughts, I know she's not quite set on the agenda, I get that, but the sooner I know, like if she can give me a day and an afternoon or whatever, a time frame, then I can start putting those meetings together.
Sure.
All right. Thank you so much.
No
I have a contact for Elena Seep, Wisconsin. Yes. So I'll get that.
Can you just email that to me?
I will get that. Yes.
All right. Perfect. Thank you so much. All right. Bye, everyone. Thank you.
Bye. Thanks, everyone.